Thank you very much indeed. I'd like to bring in my colleague, Dean Russell.
Thank you, Chair. Thank you for joining us today as a witness. I noted that one of your areas of expertise is around big data, and as part of the Joint Committee for Human Rights recently, one of the big focus areas was around the use of data from this app and concerns around the storage of that and future use, even if it's anonymised. And I just wanted to get a sense from you of how that plans to be used, but also is there a detrimental effect of deleting all of this data at some point when perhaps it could be used in big data modelling for future epidemics or pandemics as they occur in the UK?
It's an interesting question. So I think the issue is also that for the intervention to be successful, the most important thing is for people to have trust in the system. And we've seen a very vigorous and I think important debate about privacy and about the use of these data and about, this is, while we're used to the idea that we often share data throughout, I think the idea of having an app that's sharing new types of data in a health system is something which has led to a very substantial debate. So I think however, if you look at the survey, so for example, Professor Carson Maple performed a survey of opinions, it seems like there's a very strong majority, more than 50% of people who support, I think 82% of people support the use of the data for research within the NHS, but then not for wider sharing with government. So I think the rules around the data are that you should use the minimal data possible, but that's still able to give the information you need for the health response. And there's been a vigorous discussion around the sort of decentralized model and the centralized model for that. And the Information Commissioner's view is that you should start with the decentralized model and then, see if there's additional justification for the additional data around around the social graph. So to be clear, the information which has been regarded as sensitive is not the information that you would upload yourself about yourself. Is the fact that you have sort of pseudonymized IDs where contact occurred between the person who had this ID and a person who had this ID, and that would be conducted at large scale. And I think exactly the same consideration would be appropriate for future use of these data, and I would say it would be very helpful, I think, in terms of the trust, to have maximum transparency about who can and who can't use these data, which are regarded as sensitive or which are sensitive from a privacy perspective, but that if the appropriate degree of oversight and both from the Parliament and from the government and sort of inherent to the organisation can assure people that there is trust in this system, then yes, analysis of this data would be useful in terms of understanding the dynamics of transmission and how that links to people's contact patterns. Because,
thank you.
Because that, to some extent, we're still discussing, should a contact be 1 meter, 2 meters? Is it, we heard previously that some people have many contacts, some people have few. We don't understand how these things correlate with the probability of transmission at this point in time.
And can I just ask a follow-up question, Chair, if that's okay?
Please do.
Yeah, thank you. So just with regard to this, so obviously collecting that immense amount of data which could help identify spikes, do you happen to know how the data from the app is being linked into the data through the wider track and trace methods, the manual methods and so on. And also, is that data being deleted as well? I mean, I'm just interested to know whether we're because it's technology environment, we're treating that in a different way through fears of data usage than we do through the wider methods. And the reason why I ask is that surely there's an element that, is there a part here that the fear of that data means, and collection of that data, fear of privacy invasion actually might mean that we miss opportunities to reduce spikes moving forward?
The first part of your question is, I don't know with regards to the with regards to these integration, and maybe I don't know. In terms of is this being treated differently? I would say so. So I've in previous epidemics I've analysed contact tracing data. On SARS I've analysed contact tracing data collected on Ebola, on MERS, and on the H1N1 flu pandemic, and it this was considered standard research data and led to immediately actionable information. So, but I guess, So I guess at this point we're seeing two sort of domains come together: the domain of public health surveillance, where it's widely understood by everybody that you're collecting these data in order to save lives, in order to improve the epidemic control, which also, allows people to get on with their daily lives, getting exactly the information you need for that to happen while reducing the risk of transmission. And digital surveillance, which is linked into a whole different debate. And I think there is an interesting sort of meeting of those two different perspectives. And that's an ongoing discussion which needs to be had. To ensure that these data are used really, I think these data can be used to improve our epidemic control, both directly through the act of contact tracing and through learning from it, learning quickly about transmission in a way that we can't do through other tools. But it's very important, since it links to this other world of digital surveillance where there are concerns. It's important that the transparency be there to make it clear that all of this analysis is taking place within the world of public health surveillance.
Thank you.